Like, what adversity do I have? So it turns out that I went and discovered my own adversity. And I think what I learned about resilience is that it's not necessarily pretty or neat. I think sometimes we want it to look really neat and clean, and it's just not. And so I think about people saying, courage is not the absence of fear, but it's like persistence in the face of fear, despite fear. And for me, that's a lot of what it is. Like, my resilience wasn't pretty.
You're listening to Becoming Wildly Resilient, brought to you by University of Kentucky Human Resources, Health and Wellness. In this series, we'll explore a variety of well-being topics with experts from the university community in physical, emotional, nutritional, and financial health. Join us, and together we'll discover how we can thrive at work, home, and beyond. Hello there. Welcome to another episode of Becoming Wildly Resilient. I'm your host, Jacob Hester, and I'm grateful you're tuning in. The voice you heard at the beginning belongs to Dr. Alex Elswick. Alex is an assistant extension professor with the College of Agriculture, Food, and Environment. He's also co-founder of Voices of Hope, a Lexington-based nonprofit supporting people who use or have used drugs or alcohol and are seeking better health. In this episode, we have a powerful conversation on addiction, recovery, humanity, and resilience. Alex has a wealth of knowledge to share from both his lived experience and professional work, so prepare to be moved and enlightened. Some of what you'll learn includes what substance use disorder and recovery look like, what people commonly misunderstand about addiction and recovery, and how we can contribute to the shifting narrative, a holistic approach to recovery, including the power of social connection, and ways we can create a more inclusive and supportive environment for those affected by addiction and recovery. You'll also hear Alex's story from addiction to recovery and what he's learned about resilience along the way. Before you get into the episode, I invite you to hit the follow button in your favorite podcast app so that you can continue to follow along. I wouldn't get to do this without you taking the time to listen each month, and I want the podcast to continue to add value to our community. So I welcome any feedback or suggestions for topics or guests. Without further ado, here's my conversation with Dr. Alex Elswick. Welcome, Alex. So grateful to have you on the show.
Thank you so much to have me, Jacob.
So can you first tell our listeners just a little bit about your role and the work you do here at UK?
Sure. So I'm an assistant extension professor, which is special title series faculty. So in addition to sort of the traditional teaching in the classroom and research, I also get to do extension work. And kind of the premise of extension, for if we have any UK folks who aren't familiar, is not everyone's fortunate enough to get to come to the university. And so extension extends that knowledge across the state. And my work focuses on substance use prevention and recovery.
Awesome. I know you also do some work in the community. So can you talk about that a little bit too?
Absolutely. So I'm a co-founder of Voices of Hope, which is a nonprofit recovery community organization. It's a peer-driven organization, which means we don't have credentialed staff. We don't have social workers or clinicians. All of our more than 100 staff are people in recovery who use their lived experience to help other people in recovery. So it's a very cool model.
Yeah, it's really amazing. We were catching up right before we started this, and I was telling Alex that we, as a family, every year do like a raffle for charities, and everybody puts in some money and then puts in a specific charity. When we kind of blind draw those, and everybody gets the full pot, whoever draws out their charity. And Alex's organization was actually the one that won at our Christmas this past year. So I didn't realize that until after I started prepping for the episode. So that was a really cool connection that I found right before we started here. So can you also tell us just a little bit more about yourself outside of work? Some of the things that make you, you.
Sure. So, I'm a person in recovery from a substance use disorder. I'm a person with anxiety disorders. I come from a pretty privileged background. I came from a great home. My dad was a doctor. Mom was a CPA. Kind of had everything I needed. I have a biological sister and a younger sister, Katie, who's adopted from Seoul, South Korea. Just a big, happy family. And me today, I play a lot of golf. That's how I make sure that I stay sane, is I play as much golf as humanly possible.
Yeah, I haven't played golf in a while. I used to love it and played quite a bit, but
that means we need to check your mental health.
I know. Yeah. I'm a little rusty. One of my coworkers, that's his big outlet for self-care, is to get out there and play golf, because it's a good opportunity to get outside and also a little physical activity too.
So I normally start off these with like a conversation starter, some random question that I'll pull out of a deck. I was getting ready in the dark this morning because my power is still out. For those of you who live in central Kentucky and still are dealing with the windstorms that we had, we're recording this the Monday after that windstorm. And I'm one of the folks who still has power out. So I got ready in the dark this morning and completely forgot to grab those conversation starters. So I Googled a few random ones before I came.
I like it.
I've looked at them. Normally, I've not seen the question either, but I'm going to let you choose between a number 1 through 5, and that'll be the question that we'll answer.
Okay. Any number 1 through 5?
Any number 1 through 5.
Let's go 2.
What hobby do you wish you had more time for?
Well, golf would be an easy answer. What hobby do I wish I had more time for? I this past year, I did a lot of hiking. And I think I'd love more time to get into the forest and just go run around. I think it's good for me too.
That's a good one.
Yeah.
I think I tend to have a lot of music-based answers, but I think for me, for a hobby, if I had more time to kind of get better at, I think I would say something related to music, playing the ukulele or learning the piano or something like that.
Yeah.
So, all right. So let's dive into our conversation on addiction, namely substance use disorder and recovery, as well as some of the lessons of resilience that you can kind of dig out of that. So I like to start most of our topics by setting a foundation with definitions or data. Can you first explain substance use disorder and how it may differ from, say, substance abuse or active addiction?
Sure. That's a great place to start. So substance use disorder is the clinical term for an addiction to drugs and alcohol. Substance use disorder is like other mental disorders. People meet a certain number of criteria in order to meet the threshold to be diagnosed with that. But in layman's terms, when we're looking at an addiction, we're looking at a behavior that someone engages in despite harmful consequences. So in the case of substance use disorder, we usually look at clinically significant occupational or social impairment. So it means basically someone's having trouble at work or school, or they're having trouble in their relationships as a consequence of their drug use.
So I know we hear a lot about like substance use disorder in the news, but what does that look like nationally and around Kentucky right now?
It's it's kind of a morbid time to be doing this work because it's arguably the most dangerous time and the most dangerous place in the history of the world to be a person who uses drugs in the United States. So we lost 100,000 people to drug overdose in 2021. And that number has skyrocketed from 40,000 in 2014 and maybe 70,000 in 2017. So the numbers continue to go up. And in Kentucky, we are invariably in the top 5 states in terms of per capita overdose rate. And we lead the country in terms of things like prevalence of hepatitis C. And yeah, the state is kind of in a bad way when it comes to addiction.
Yeah, I think that speaks to the importance of the work that you do, and how challenging that is. And I think as a person helping people too, that can be really daunting at times. So I think from the angle of like self-care in those challenging times, I think you'll have a lot of personal experience from that. I hope you'll be able to share with us as well. But what hopeful signs are you seeing in sort of data and practice as well?
Yeah, I think there's a number of things that are hopeful. One thing that's hopeful to me is that the narrative around addiction is starting to change, not just in the general public, but also in healthcare settings and even within addiction treatment settings. We're starting to look at addiction with a little bit more of a realistic lens that comes from science, that comes from data, starting to understand addiction as a chronic disorder, meaning a long-term disorder. And for so long, we've treated it as an acute disorder. So there are hopeful signs, but I don't want to, just in the interest of trying to be optimistic, I don't want to mislead people. Things are not going the right way at present.
Yeah. Yeah, it's really tough. And how many people do you think are affected by that, whether that be like they're individually, experiencing or actively addicted to something, or in long-term recovery, or kind of a secondary to that?
Yeah, there's a Pew survey data that would suggest about 45% of Americans are directly impacted by a substance use disorder, either because they have a substance use disorder themselves or they have a loved one or a concerned other with a substance use disorder.
I mean, that's the half of our country. That
Right.
is pretty staggering to think about. even in this room, we have two people who have been affected by it in different ways.
Mm-hmm.
You've already mentioned your personal experience, which we'll dive into a little bit more here in a minute, hopefully. But I mean, even personally, same thing. I've had family members who have been through that long road of recovery and seen that firsthand and how that affects folks. So I mentioned to you, my sister works in recovery services as well. So definitely a subject that's like kind of close to home for me. And based on the data, it's close to a lot of people,
Right.
which is really, really hard to kind of wrap your head around, I think. So what are like some of the risk factors or predictors of addiction?
Sure. So there's, we could go over a big, long list of dozens and dozens of risk factors. Risk factors refer to just anything that increases the likelihood that a person will experience substance use disorder. The most robust, the biggest risk factors, the first one is genetics, really. In fancy statistical speak, we say 50% of the variance in substance use disorder is explained by genetics, which is sort of layman's terms for saying about half of what determines whether or not you'll experience an addiction is genetic. And that's not really something we can modify. So, the heritability of addiction is a big risk factor. And then beyond that, I mean, you could broadly think of them as just different forms of suffering, but co-occurring mental disorders. So about 40% of people with substance use disorder have a co-occurring mental disorder. Definitely that was my experience as well. And then trauma, childhood trauma, adverse childhood experiences. The link between trauma and addiction is actually stronger than the link between obesity and diabetes.
Wow. Yeah, we've talked about adverse childhood experiences in a previous episode. And that's, certainly sounds like one of the longer term byproducts of something like that. Or we kind of talked about like, are kids resilient? It was kind of where that conversation was going. And like, by and large, yes, but if they face significant, trauma as a child or any other sort of ACE at that time, you can see where that could lead them down the road as well. So I think it's always important to kind of think about these things. And I think that'll help us in the latter part of this conversation too, about like what we can do as individuals, how we can contribute to help mitigate a lot of those things too, I think. So what do people commonly get wrong about addiction and substance use disorder or recovery?
Yeah, great question. There are lots and lots of answers I could give you because I think in general, most people misunderstand addiction by quite a lot. I think maybe the first thing that people misunderstand is in addiction, what we see is the externalizing behavior, the substance use and all the accompanying behaviors. But what a substance use disorder is at its core is a brain disorder. And so even though that's something we can't see, that's really where addiction, the problem lies and also where our solution lies in large part. And then I think two other things I would mention. One is something I teased before, which is this idea that people want to send somebody to a 30-day treatment center and think that this is going to be the cure. And unfortunately, when you look at the research and you look at the brain science, the prolonged changes that occur in someone's brain because of a substance use disorder are like 3 to 5 years of protracted changes in the brain. And so a 30-day treatment center might be an important first step have a period of like crisis stabilization, but it by no means is a cure or a treatment that matches the chronic nature of addiction. So I think that's a big one. And then if I can the last one I'll mention, because there are so many, but just thinking about things that I think people misunderstand about addiction is, I think people misunderstand that person can be trying and failing at the same time. And I think we know exactly what that looks like in most other contexts. And for some reason, it's become unacceptable for people who have substance use disorders. And it's like, okay, you have a problem with drugs, then the only solution we offer you is to get completely abstinent and to get completely abstinent right now today. And if you're not willing to do that, then we're not willing to help you. And I can't imagine what the equivalent would look like for someone, let's say, who's 100 pounds overweight. And if we said, if you're not willing to lose 100 pounds, if you only want to lose 50, it's not worth trying, Yeah.
Yeah, that's a really good way to kind of think about that. And I guess sort of the how that, again, that comparison to like well-being and other concepts that we think about. I think we've tried to shift that narrative some, and it's much more successful with other things. I mean, you've mentioned an example there already, but yeah, that like all or nothing.
Yes.
And like kind of losing the sight of positive steps along the way. And I guess it may go back to that assumption too that you said, where folks think that it's like almost kind of quick, and like 30 days is going to solve it and fix everything. I mean, there's very few things like when it comes to your well-being that you're just going to instantly solve in 30 days and then never have to turn around again and focus on ever again.
Right.
Really doesn't work that way. We've kind of talked about this in the last 4 or 5 episodes, really, about this sort of like ever going process for any sort of thing that you're focusing on with well-being. And I think that we're seeing that, I guess, in your answer as well, when it comes to addiction and the process that it takes to get there. What did you say? Like failing and at the same time as
trying and failing at the same time.
Yeah.
It's I think a helpful piece of advice for family members, because I think it's a really difficult position, and I can empathize to be a family member and see your loved one struggling with addiction. But I know for a lot of us, we've come to see addiction as a brain disease, and we can kind of accept that. But then when a person experiences a relapse or a return to use, all of a sudden, it seems like people forget that. And so when they got addicted the first time, we said, okay, they have an addiction. That's understandable. It's not their fault. They deserve treatment. But then when they experience a relapse, we said, well, you chose that. You chose drugs over your kids. And it's like, well, hey, they still have a chronic brain disorder. That means their brain is still being impacted by the drug use, even if they haven't used a drug in 30, 60, 90 days, whatever it is. So yeah, I think that's, it's hard to understand, but if once you understand kind of the brain science and just the nature of addiction, it all kind of starts to make sense.
Yeah, it's interesting that like the brain science is kind of stimulating that empathy in a way. Like that's kind of how you can, to me, that's what I'm hearing is like, we've thought about it in this way in the past. It's like, oh, these are choices that you made, but about 50% of it is genetics. That's not really a choice you made.
Right.
And so to like get some of that empathy from others and kind of understand, especially if you've been fortunate enough to not be affected in some way by it, thinking about it as a brain disorder, it's something that you're still going to have to continue to work on continuously. And I guess that's probably where that narrative has shifted from just habits or something like that, or choices that you made, to like, this is actually something kind of scientific long-term that have, certain avenues that we need to approach to continue to do that. So I think that maybe kind of explaining recovery might be really interesting in this context here. So I think that'll kind of help with that as well.
Yeah. So kind of depends on who you ask, because I would argue that, as you ask kind of what do we get wrong? I would argue that part of the problem is that we've been focused really myopically in a really short-sighted way on abstinence as the goal of everything. And so I think a lot of us think, well, if we think that the drugs are the problem, then it makes really logical sense that if we take away the drugs, then we no longer have a problem. But if you understand that drugs are really more often a solution to someone's problem, and the problem exists in their brain, then recovery looks a little bit different. So SAMHSA, which is the Substance Abuse and Mental Health Services Administration, they define recovery as a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. And I love that definition for a bunch of reasons. One, because it doesn't focus on abstinence, focuses on health and well-being, which is really what we care about when we're thinking about our loved ones. I'm not so much concerned with the results of your 12-panel drug screen. I'm concerned with whether or not you're happy and healthy and doing well. But also those first few words of that definition, a process of change, I think typically we would breeze through those when we're reading that. It's terribly important. Recovery is a process of change. That means it's non-linear. That means it's 2 steps forward and 1 step back. It means fits and starts, and people experience, commonly experience a return to use as a part of their recovery. And so because that's just very characteristic and typical of recovery, we shouldn't punish that. So that means we don't need to kick people out of housing because they've had a return to use. We don't need to fire people from their jobs. We don't need to, what we're doing at that time is taking away from people the things they need at precisely the time they need them the most.
Yeah. Yeah, absolutely. So let's get into your story if you're willing, because I know you've had the opportunity to share your personal story both locally and nationally. I know if you Google your name, you can find speaking events you've done with former attorney general, former president, really, really high level, and then also just around the state itself. So if you're willing, like I said, can you tell us just a little bit more about your story from addiction to recovery?
Sure. Yeah. I take advantage of every opportunity to share. Sometimes I even think I overshare, and some people have heard it too many times, but research shows it's the most effective way to reduce stigma, to change people's hearts and minds. So I take every opportunity. So the really quick, short version is I'm from Lexington, born and raised. And as I mentioned earlier, born to really, really privileged circumstances. Dad's a doctor, mom's an accountant, really had everything that I needed and a pretty ideal childhood. but I inherited some of the risk factors that we mentioned for addiction. So a genetic predisposition, there's a ton of addiction in my extended family, which I was not aware of when I was young. It wasn't a conversation we had in my family. And then secondly, from the time that I was about 12, and it's funny because I've just been reflecting on this a lot lately. Up until the age of 12, I think I was a really, really happy, well-adjusted kid. And if you'd used my first 12 years of life and extrapolated that, you would have said, Alex is going to have it easy breezy. And that's what I thought was coming, you know? And then I'm starting about the age of 12, I think with adolescence and puberty and all the hormones and all that stuff, I got one of those chemical imbalances and I started experiencing symptoms of anxiety in a way that I had never experienced it before. And, I ended up being diagnosed with 3 different anxiety disorders. So generalized anxiety, social anxiety disorder, and trichotillomania, which is like a hair pulling disorder. And, but those disorders didn't get diagnosed till I was 21 or 22 and in my first treatment center. And so I think it's just important to mention because for me, it meant I spent like 10 years of my life struggling against anxiety. And I didn't really know, the way I always explain this is like, no one needs to tell your body that it has anxiety. Like you just feel it and you know that something's wrong. But also I didn't know that what I was feeling was like a clinical condition and that it was this characteristic thing that, can be treated and can be addressed. And so, I started experimenting. And when I was 18, I got prescribed opioids. I had wisdom teeth removed and took them as prescribed, but ended up getting addicted. And addiction, addiction took me every bad place that people go. I went in and out of treatment a lot. And that was how I learned part of the lesson about the need for long-term, continuum of care, not just putting people in 30 days, because I would do really well in 30-day treatment centers. And for 30 days, I would do all the right things and I would be getting better and my tolerance would go down and my cravings would go away and my withdrawals would go away. And it's like, we're heading in the right direction. The problem is I would get out on day 31 and I'm still very much have this addicted brain and I'm just left to my own devices out in the world and I'm not ready. And so I did it over and over and over again and went in and out of jail, on drug trafficking charges, went on and off the street. I ended up homeless in a few different cities and spent the very end of addiction sleeping under a bridge in Dayton and, panhandling for money and injecting heroin. And I ended up walking into a Salvation Army, which is a homeless shelter that has sort of a treatment component there in Dayton. And I stayed, I think, only because I had nowhere else to go. But for what it's worth, the first 30 days that I spent at the Salvation Army are the worst 30 days of my whole life. And it's so clear to me to say that. But then things started to get better. I'm at this shelter in Dayton. You wouldn't think that your life could be very good in that position, but really slowly I was experiencing my brain starting to heal. And so I always tell people they're quirky examples, but the 2 ways that I knew that my brain was actually healing in a meaningful way was because of food. All of a sudden, like we would have biscuits and gravy on Saturday mornings at the Salvation Army. And I started going to bed on Friday night, like real excited, like, oh, we're going to have, and it's a silly example, but it really was my first indication that I could get a good feeling out of something other than a drug. And then you mentioned music. And for me, music was a way that I knew my brain was coming back because I had not really been able to enjoy music for a long time because you just can't vibe when you're addicted, when you don't have the dopamine you need. And there are some songs that were on country music radio at the time that I was in the Salvation Army that have a really special place in my heart because it's just when I could feel again. It's like your life going from black and white to color. And all of a sudden there's depth and there's weight and there's substance to your life that there wasn't before. So that was pretty cool. So anyways, long story short, then I spent 6 months at this shelter. I had so much help, Jacob. Like I couldn't possibly sit here and itemize all the different ways that people helped me, both because I was lucky, because I was privileged, because all those things, but I had help getting a job and I had help getting housing and I had help getting health insurance and getting transportation, accessing mental health services, just all the things. And so anyways, I guess to summarize that, I would say I get lots of pats on the back and attaboys. And I'm not going to act like I don't like it. I think everybody does, but I think it's unfortunate and unfair sometimes because I get pats on the back for my recovery when I had so much help. I had every advantage that you can list. And so many of my friends are suffering in their addiction right now, and people are blaming them for that. And they're acting like the difference between them and me is that I wanted it and they don't. And I know that that's not true. I know that the difference is they don't have the things that they need. And if they did, that they would be well.
Wow. I don't really know how to even follow that besides just saying thank you so much for just sharing that story with folks to have just a minor understanding of what that's like. And I feel like this is one of those points I just want to leave a couple of seconds of dead space in the audio just to let people kind of process for a second. But as I think about your story, and you highlighted it quite well there about the number of folks that helped you to get to that point, and maybe the financial resources that it took to get to that point, and the privilege that you had to have all of those supports and the things that you needed to get to where you are. And it was still a challenge. And all of the folks who don't have one or more of those supports or the things that they need, and just how many more barriers that's creating for folks.
Yes.
And so when I was thinking about this episode, that's kind of what I had in the back of my mind is what can we do with our privilege? What can we do as, community members with someone that's struggling with it, or with someone who has a family member that's struggling with it, or a close friend or a loved one, the things that we can do. So yeah, I don't know. I mean, it's one of the first times I think I've been on the podcast that I'm really sort of speechless with hearing a story like that, because it's just, it's so powerful to me. And just to kind of dig back in my brain and think about watching my family members go through that as well. And I think for me, it was helpful to be exposed to that addiction early on. I think I was about 12 or so when I was really exposed to a family member who was severely, an alcoholic. And I got to see them in the hospital at a really, really low point, which turned out to kind of be the turning point. And so that absolutely stuck with me throughout my adulthood, and thinking about it and trying to put that humanity on a subject like this.
Yeah, thank you. Thank you for sharing that. And it reminds me of kind of another cool connection, which is I just met a new UK employee last week who's in recovery, and she and I were talking about basically our privilege, the access to the resources that we had, and what an advantage. And she basically said exactly what you've just said, which is that we had every advantage and we nearly died. We had every advantage and we almost didn't make it out. You want to talk about stories of resilience. It's remarkable. It's the things that some people just endure every day. It's incredible. My heart goes out to so many of my friends and so many people in the community who've suffered a substance use disorder without the money for treatment, without the money for stable housing, without family support, the list is ridiculous and long.
Yeah. So you mentioned kind of stories of resilience, and maybe start with what you personally learned throughout this entire process, from kind of childhood through now long-term recovery. What have you learned about resilience in that time?
Well, one thing worth mentioning is when I was about, I think 16 or 17, I had a conversation I distinctly remember with my father where I was kind of lamenting the fact that I hadn't experienced any real adversity. And I was kind of saying to my dad, all these great people in the world, they all have to overcome something to be great, and I'm like, look, I grew up, I was a white kid in the suburbs, what adversity do I have? So it turns out that I went and discovered my own adversity. And I think what I learned about resilience is that it's not necessarily pretty or neat. I think sometimes we want it to look really neat and clean, and it's just not. And so I think about people saying, courage is not the absence of fear, but it's persistence in the face of fear, despite fear. And for me, that's a lot of what it is. Like my resilience wasn't pretty. My first couple months, I moaned and whined and I wanted to do anything else. And I wanted a different solution and I wanted a different way out. And if anyone had offered me anything like that, I would have taken it. I wasn't strong about it. I wasn't tough about it. I just kept putting one foot in front of the other. And I whined while I did it. And you know what I mean? And I struggled and it was not pretty the way that I did it. But I think that's what I learned is resilience can be messy and that's okay. It just takes what it takes,
Yeah. Yeah. That's a good way to put it. It's not clean. It can be messy and it can look like you not wanting to do something and complaining about it in the process, but you still took the steps forward. You basically kind of looked in that moment, what's the one thing that I can do to keep moving forward and take that one little step. And so for me, that is how I think about resilience. And so that's a good way. I haven't put it that way in the ppast, but I might steal that from you and start using it that way. What about like through the work that you've done and the times you've shared your story or your nonprofit efforts? What other kind of stories have you heard or that have kind of shaped your view on resilience?
Yeah, I think mostly what I want to make clear is that I'm sure I do have some resilient bones in my body, but they're not special and they're not different from anybody else. And I get a little too much credit. There are people who it takes an incredible amount of resilience to just show up every day, just get out of bed every day and just the kind of poverty, the chronic homelessness that people face in our community, a lot of the folks we work with at Voices, the kind of resilience that it takes to wake up from under a bridge and go out into the world and still interact with people and smile and treat other people with dignity and maintain your own dignity. I mean, to me, that's an incredible form of resilience. That's a toughness that I don't well understand. And I think something else I've learned about resilience is that it's an awful lot easier done together. And that's a little ironic for me to say that because I'm the type who, especially when things go wrong, I tend to isolate. But I've just learned the power of connection, the power of having people. Some of the relationships that I formed at that homeless shelter are some of the most meaningful relationships I have, especially with men in my life. And I just don't think I could have done it without other people standing beside me saying, me too, I understand, I get it,
Yeah. Yeah, I think that togetherness aspect is really important because I think the old narrative of resilience was that sort of, kind of an American way, pull yourself up by your bootstraps
right.
And nobody's going to do it for you. Which there's elements and times where, yeah, I mean, it's going to obviously take your effort and you making a move. But it's so much more effective when we're together in that. And do you find that like in the work that you do, that sort of togetherness is, I guess, part of that treatment plan, maybe?
100%. So we don't have time to do the whole long brain explanation. So the quick, dirty version is what addiction is actually doing through repeated drug use in the brain is causing the down regulation of dopamine. So in the most basic terms, when we're trying to heal the addicted brain, what we're trying to do is the opposite, upregulate dopamine. So you might ask a question, which is, are there some things that we can do that'll expedite upregulating dopamine? So basically, in layman's terms, can we heal the addicted brain faster? It turns out one of those things is social connection. Research shows that any kind of pro-social activity where you're just engaging with another human being, not only do you get a short-term spike in dopamine, which allows you to experience euphoria, but long-term, it makes your dopamine levels return to normal. It's why our entire recovery community center model is predicated on connection. Connection first, connection way far above abstinence. So whereas, another organization might say, well, you come to us when you're ready to be abstinent. We say, come to us right now, today, as you are. Let us start connecting. Let us start identifying needs, start identifying gaps. And the ironic thing is sometimes we do that with folks who at the beginning have absolutely no stated interest in abstinence or changing their drug use at all. But by the time that we've spent some time engaging with them, showing them that there's some opportunities, giving them the connection and belongingness that they need, all of a sudden they have the hope that maybe abstinence is an option for me, or maybe there's a kind of recovery that does work for me and they get interested. And that's the most gratifying part of the work we do.
I imagine. Yeah. So let's kind of get into that work a little bit more. So I know your research centered on long-term recovery and a concept called recovery capital.
Mm-hmm.
So can you explain what that is in practice?
Yes. So recovery capital, you think about other times you've heard the term capital, like social capital or financial capital, just refers to resources. So recovery capital is recovery resources. And it's a really zoomed out, holistic way of understanding the totality of resources that people need to sustain their recovery from addiction. I think if you went into the general public and asked a layperson, many people might say, well, they need treatment. And that's the first thing and oftentimes the only thing that comes to mind. And so we're neglecting to think about what's their housing look like long-term? What does their social interactions look like long-term? All of those things. And so that's the premise we use. It's kind of the foundation of Voices of Hope and my research at UK. So for instance, when we evaluate a program, we're not asking ourselves how many people were abstinent as a result of this program. We're asking ourselves, at least at Voices of Hope, how many people gained recovery capital as a result of this program? How many people have improved their housing, their connections with other people, things like that?
Yeah, that's a really interesting way to kind of switch thinking about effectiveness of a program and that sort of thing too, especially if you're looking at that long-term. I feel like if it's a really long-term game for recovery, it's really challenging to assess that, right?
Yes. And especially if it's going to be in categorical terms of either you're sober or you aren't. Whereas if this is a process and we can have some ways to evaluate small but meaningful improvements, then we can let people be in the process.
Yeah. Because I feel like you talk about recovery too, right? That it's not like you mentioned, I think at the jump that you're like, I'm a person in recovery.
Mm-hmm.
And it's like, it doesn't end. It's never clean. And you can sort of wax and wane between those two, even. And I think that's another important point to point out when it comes to this and how we think about it and how we speak about it or how we think about what success looks like in the long term, not only for an individual, but for, us collectively or the research or the centers and those kind of things too. So that's really interesting.
It's kind of an exciting, I think, new frontier in the field. And so I've had the opportunity just now to do some research with some folks in the Center on Drug and Alcohol Research, looking at non-abstinent outcomes, recovery outcomes for people with methamphetamine use disorder. And so we're trying to get a sense of, instead of making it just either you're sober or you are, what are some other meaningful indicators that let us say, hey, even though you may still be using drugs, your life is improving. The quality of your life is improving. Something good is happening here. We want to pay attention to it.
So I asked the question at the beginning, what are some of the risk factors or predictors of addiction? Is this sort of the flip side to that, where basically the predictors or success factors, I guess you could say, of recovery?
Yes. Yeah. We talk about protective factors, and that would be anything that reduces the likelihood that you're going to experience an addiction or increases the likelihood of recovery. And in many ways, they overlap with just recovery capital. And if you're a public health person, we think about social determinants of health. I mean, it's not an entirely new concept, but when I talk about recovery capital, I think sometimes people go, oh yeah, people need resources to recover. We know that, but it's actually a little more complicated than that, or a little deeper than that. Recovery capital is so important that it, in many cases, precludes the need for treatment. So this is a pretty surprising finding to me, at least in the research, but the majority of the people who are in recovery today in the United States didn't get there through treatment, and they didn't get there through a 12-step program, and they didn't get there through outpatient counseling. They got there on their own. It's called natural recovery, and it's actually the most common pathway of recovery. And so it speaks to the need, at least in my view, for recovery capital. If you spend more time focused on people's housing and their employment and their relationships and their mental health and all of the needs that need to be met, in many cases, people don't even need to leave their community to go to a 30-day treatment center. They just can sort of stop.
Interesting. Yeah. I mean, I didn't know that. I think, again, sort of that traditional view of treatment centers and all that sort of things, 12-step programs. I think that's the way that we've grown up, or that it's been talked about. And you don't really hear those stories.
No,
so much. Yeah. Right.
You don't. Even when we look to lift up an example, a champion in recovery, lift up an example of a success story in recovery, invariably we tell a story of someone in abstinence-based recovery and probably who comes from a 12-step program. So we just keep telling the same story. My friends and I talk about it as the single story of addiction. We keep telling a single story, even though experiences in addiction and recovery are as diverse as the people who are addicted in recovery.
Yeah. Yeah. And that's why I liked hearing your story too. And just the power behind you saying that, like, hey, I had all of this help. I had all these people. And again, that's like the hard part, is that it requires all of these resources and supports that folks may or may not have access to, or we may or may not prioritize as individuals or as a community member, or as just generally as a society.
Part of the challenge with my job maybe in talking about recovery capital is that I'll come from Lexington and I'll drive to Eastern Kentucky, let's say, as an example, and be talking to a community. And what recovery capital is going to look like in that community is so different than what it looks like in Lexington. And they have so many fewer opportunities to meet needs. It's a big challenge.
Yeah. It's kind of like a framework for a tailored approach for individuals, right?
Absolutely.
Yeah. So I guess how does that really differ from those previous approaches we've touched on a little bit?
Yeah, I think part of it is that myopic view that abstinence is the goal. Because the reality is, you send some, especially in the context of this opioid overdose epidemic, if you send somebody to treatment who has an opioid use disorder today, then in 30 days when they get out of treatment, they're more likely to experience a fatal overdose, not less. So that's not to say that treatment is a bad thing. It's simply to say that the fact that somebody's abstinent for a day at leaving treatment is not the ultimate goal. The goal is long-term health and wellness, long-term safety. So it's really a radically different approach in a lot of ways. It also kind of borrows from harm reduction, if you're familiar with harm reduction. And I think that the most straightforward way to understand harm reduction is, whereas the old approach, the abstinence-based approach or the prohibitionist approach said, we want drug-free communities. We got to get rid of all the drugs. And that's obviously not been successful. This harm reduction approach would say, look, people use drugs. And we don't have to like it. You may not like it. I may not like it. It may be an uncomfortable fact, but it's a fact nonetheless. And so instead of running from it or minimizing it or ignoring it or trying to condemn it, instead, let's live in that reality and say, if we have people in our community who are using drugs, how can we make sure we keep them and the people around them as safe as possible? And so that's really how this approach kind of takes a different orientation and is oriented to a different goal, basically.
Yeah. So kind of thinking about recovery capital in a broader scale, what are some of the elements of this concept that anyone could apply, to our individual or collective well-being?
I think what recovery capital does well is it zooms out from the problem. And so sometimes we get too close to our problems. And recovery capital is a way of saying, hey, let's go and look at these fundamental aspects of human wellness, and let's make sure we're tapping into the fundamentals. So usually when I present on recovery capital, I put it right next to Maslow's hierarchy of needs, right? It's just a way to say, hey, yes, we have a drug problem that we're trying to address in this case, or maybe in someone else's case, it's an eating disorder or whatever it is. But rather than getting too focused on that, let's also make sure that at the same time, the quality of this person's sleep is really good. And the quality of this person's nutrition is really good. All these things that we already know are really important indicators of health. Because most often, not always, but most often, when a person is dealing with a substance use disorder, those other things start to go as well. And so then it becomes really difficult to ascertain which of these are consequences of drug use and which of these are actually consequences of just sort of neglecting your health. And unfortunately, what ends up happening is drug use gets scapegoated for all of it. So we say, look, drugs cause all these problems, but not exactly.
Yeah. There's quite a reciprocal relationship, or just like a really intricate web of all these different factors and how they connect to each other. And that's where I guess it can get really, really individualized, and how the challenge, I guess, with like maybe a very strict program or something like that can come into play too. When you mentioned that there's so much diversity within everyone's experience, just within their experience with addiction, not even like the diversity within the individuals themselves.
Right.
So I'd like to wrap our conversation up with how we as, UK employees and community members can do our part to create a more inclusive and supportive environment for folks experiencing or affected by substance use disorder and long-term recovery. So first, what would you want others to know about people in recovery, or those that are still battling addiction of some sort?
Great question. I think I want you to know that we're just people. And I know that seems like really cheesy, but there's so much stigma surrounding being a person with an addiction, that we're violent or that we're untrustworthy, or all these really negative associations that are really harmful and that really limit opportunities for people like me. And so the thing that I want people to know most is I'm a person with a problem. That's what it was. I was a person with a problem and in need of a solution. And I'm not bad. I wasn't a bad person trying to be good. We talk about being a sick person trying to get well. And that was really what it was for me.
Yeah. Those negative associations, you hear that all the time when maybe a new, they're putting a community center in an area, and you get pushback from the neighbors or something like that. Or maybe like a halfway home, or another supportive home like that. You hear that, like I've seen it on social media recently, like in next door, where people are complaining about this house going in, this house being converted for this purpose. And it's because of those negative associations.
Yes.
And it just it's painful almost to read that and just see all of that, like humanity just stripped out.
Yes.
And like that person is a drug. They're not a human being any longer. They don't deserve to have a safe place to sleep, and a roof over their head and a warm, or in summer, a cool place to be. They don't deserve the same things that I deserve. And that's so, I don't know, it's just so disheartening to read those kinds of messages. So, I know you felt like it was cheesy to say that we're people, but I think to me, that's how I see it too. Is like, if we're going to change these narratives, if we're going to do any good, we have to start seeing the humanity
Yes.
in the other person, regardless of whatever is going on with them, and see what we can do to contribute. So I guess that leads to that next question is like, how can we turn that into compassionate action of some sort? What can we do to support people affected by addiction, or in recovery?
Yeah. So relatedly to what we were just talking about, trying to humanize it and personify it and put a face on it. We talk a lot about the importance of using destigmatized language. And I love talking about language because I'm a millennial. So there's been that narrative about millennials that we're too politically correct and we're marshmallows and we're snowflakes and blah, blah, blah. And there's all this great empirical science now that's like, hey, this isn't about political correctness. This is about the fact that language actually matters. So a great example is when I first started speaking publicly, I would stand up in front of a room full of people and say, my name's Alex and I'm an addict. Or my name's Alex and I'm an ex-addict, or I'm a recovering addict. And it's true. So I didn't think there was anything wrong with it. But I came to understand that there's a ton of stigma associated with the word addict. So for instance, if I try to walk into a job interview and I say, my name, I'm Alex and I'm an ex-addict, I'm significantly less likely to get that job than if I were to walk in and say, my name's Alex and I'm a person in recovery from a substance use disorder. So it may, denotatively, it may mean the exact same thing, but it definitely makes people feel differently about it. And this really matters when it comes to policymakers, decision makers, power players. And you're talking about a legislator or a judge. I mean, a judge is a great example, someone who's literally going to be wielding power over someone's life. The way that they talk about addiction informs the way they think about it. And that's going to inform the way they treat someone who's addicted. So we talk about using the importance of person-first language. So a good way to humanize addiction is to say, I'm a person with a substance use disorder, because the primacy there, the thing we're trying to do first is acknowledge my humanity. And the fact that I have a substance use disorder is secondary.
Yeah, we talked about the importance of person-first language in the episode we did on disability.
Yes.
And yeah, and the power of that. And if you are unsure with that, they basically recommended like, ask the person.
Yes.
Again, it's a point of connection then, and you understand what it is that, how they want to be addressed, or how they want to be viewed. And that's, yeah, I mean, even your personal example of like standing on a stage and leading with, I'm an ex-addict versus leading with, I'm a person in recovery. Could you like sort of sense that in the room? Could you like see it on their faces, the difference?
Yeah, I can sense it in how much less, like, I'll tell you when I sense it is if I go try to meet one-on-one with a legislator, or I don't do as much of this now working at UK, but it was just with voices, and we would go and try and advocate for something. As soon as the word addict comes out of your mouth, I just think there's a little bit of a coldness that comes. It's something different. The recovery, I don't know. It's just an example. Another example is our employees, maybe I'll get a text message or an email that says, I'm 5 years clean today. And of course, my only response is to celebrate them and, all that. But in my head, what I'm thinking is there's no way you're 5 years clean because you were never dirty. You're not a dirty, there's just, if you go get tested for COVID-19 today, your physician's going to come back and either say you're positive or negative. They would never dare say you're dirty with COVID. It's such moralizing language, but we've come to accept that for people who use drugs. My friends aren't dirty,
Yeah. I mean, again, just a small little tweak in like one word that you choose and the difference that that can make. Again, I mean, sitting in my position, I didn't think about the connotation of saying I've been clean for so long implies that you were dirty.
Right.
And you don't think about that, especially if you haven't lived it.
And I never want to, I train on language a lot, and I never, ever want to shame anybody. It's not the goal. Don't want people to feel bad about it. I'm guilty of having said all of those things back in the day, but it's just that thing when people ask, what can I do to be a part of the solution? This is actually pretty low hanging fruit. And so at first it's clunky. The first time you say, my loved one is a person with a substance use disorder, instead of saying my loved one is an addict or an alcoholic, it feels really hard to get the words out of your mouth, and it feels like labor and work. And I'm just telling you, it's absolutely second nature to me today. When I teach it in my class, we go over it the first day of class so that students have the entire semester to practice. I don't take off points for misusing language, but we try to make a concerted effort to use destigmatized language. And it's just a powerful way that people can advocate, because that means every single time you're having a conversation related to drug use or addiction, you're just slowly, a little bit at a time, destigmatizing it. That's pretty cool.
Yeah. Yeah. I like the taking away that sort of shame and stigma from that, so that you are, you're more willing to continue to try to make that effort. I could certainly see if you were, shamed for using the wrong language, accidentally. Maybe you were completely ignorant to the fact that was not the way you should be saying something. And if you get chastised and then you can't clam up on it, you may be sort of, I guess, depending on how you react that way, you may be less likely to do something in the future that may leave a sour taste in your mouth.
Yeah.
So yeah, I mean, I guess it can kind of go both ways too. And I guess putting the humanity on people who are trying.
Yes.
Right.
Yes.
I think that's the difference.
Honoring that.
Yeah.
That's a really well said, I think, is just trying to honor people who are trying. They're making an effort. I mean, yeah, we're not trying to shame anybody. But when people ask, what can I do? And then I talk about language and they tell me that's too much, then you're like, okay, well, I don't know how excited you are about being a part of the solution. That's all we're asking you to do is change it.
Yeah. And that's interesting. That's interesting that it feels like too much, because it seems like, maybe it's the nature of the work that I do, but it seems like it's basically the bare minimum that you could do, because it's just literally language. You're not asking anyone to donate money. You're not asking anyone to spend time in a community and volunteer. You're not asking anyone to really give anything up besides a few words that they use that you shouldn't use, that because of these reasons, So yeah, it's interesting to see, again, sort of how people perceive that, and then how do we, kind of talk about that in a way that kind of helps them see like, oh, this really does make a difference.
Yes.
To these folks, and how, again, it's not just to an individual, it's to that language all the way up to how we create policy and how that is talked about. And so that it's really kind of a ripple effect, I think.
And that's why it matters. I can see where if you thought this was just about political correctness or using nicer words, you might be inclined to roll your eyes. But when you can see the research on, it changes whether a judge is going to send someone in drug court to treatment or to jail. It changes whether or not a probation officer is going to revoke or give it changes really meaningful decisions that the policymakers and power players are making. So it really matters on the ground.
So what about specific recommendations for fostering belonging in the workplace related to substance use disorder and recovery? I mean, we've mentioned it. It's about 50% are affected in some way.
Yes.
So that's, half of our population, 30-ish thousand employees, about 15,000 employees that are affected in some way. How do we make this more a part of the conversation and just create a more inclusive and supportive environment?
A couple of different ways. I think making it a part of the conversation is the way to make it a part of the conversation. The first thing I would say is that what's happening in the dark needs to be brought into the light. And so we need to be able to talk about addiction and recovery, take an opportunity to train employees on the basics of addiction and recovery, help them understand what's happening to their coworkers. I think it's awesome when employers can have a champion in recovery, someone who's out loud, recovers out loud, so that they can be kind of the lightning rod for people in recovery in that community. They can be a source of connection and belongingness, connect people to resources. And then I think the better that employers understand addiction as a chronic disease, the less likely they are to fire employees or, which by the way, then is not just a problem for their employee, but for the employer too, who experiences turnover and has to go train and deal with that expense. The research would say it's a lot more effective if you have an employee assistance program, if you have a back to work plan, those kinds of things, to really be supportive of your employee and recognize that their addiction and recovery isn't altogether a liability, that it comes with assets too. workers in recovery take fewer vacation days, take fewer sick days. There are really some strong advantages to having people in recovery on your team.
Interesting. Yeah, that's really good information to know as well, from like a hiring perspective. And I guess, again, the same thing, so that like stigma that you may have when somebody walks in and maybe they disclose that they are someone in recovery. It kind of changes that narrative. Like, you can take this and make some positive aspect out of this, that they can be just as productive as anyone else. And so I don't know. Yeah, I think that dark to light concept, and shining light in those sort of dark corners, so to speak. I think that's been kind of a thread from some of the previous episodes as well, and related topics. So on the subject of support, where can listeners find support, both those experiencing it personally, or as an affected, friend, family member, or colleague?
Great question. The state of Kentucky has a treatment locator that's really simplified for families the process of identifying appropriate treatment. It's called findhelpnowky.org. And it gives you about 5 screener questions that are pretty quick and easy, related to what type of insurance you may have, how you might want to pay, if at all, the gender of the person seeking treatment, those kind of basic demographics. And then it'll populate a filtered list. And it's I think a lot of people today maybe can't appreciate what a big deal it is to have a real-time treatment locator, because it used to be in that moment when your family member, your loved one was finally willing to go to treatment, you're calling around like a maniac and you're calling all these numbers to dead ends, and this treatment center doesn't exist. And so it's a really big deal. The treatment locator, there's also a housing locator related to that. I can't remember exactly the address off the top of my head, but could probably just Google Recovery Residences Kentucky, and there's a great search locator for that also, to look for halfway houses and transitional living and different kinds of supportive recovery residences. And then for employees here at the University of Kentucky, there are also a number of things, as with, when you live in this big city that is University of Kentucky, a lot of times you don't know about all that exists. So from my clinical time in the marriage and family therapy at UK, I know that the Family Center has the refer program. So all UK employees can be seen there for free, I believe. And it's a great way. Family therapy can be really effective for families where there's substance use disorder, and especially in cases where you have someone who's kind of resistant to treatment, not interested in that. It can be a great first foot in the door to get everybody on the same page. So I would commend that to folks. And then there's a collegiate recovery community here at UK for students, also for faculty if they're interested, and staff. I know when I got back from treatment and tried to finish my bachelor's, it was really hard, because it's an awfully hard environment to try to be in recovery and, in my case, be abstinent. So having that kind of supportive infrastructure was a big deal for me as well.
What about other resources you recommend for people to learn a little bit more? Any essential reads or watches or listens?
I love that question. Yes. My favorite book to understand the brain and addiction a little bit better is called Unbroken Brain, and it's by an author named Maya Szlavitz. She's a person in recovery and a brilliant, brilliant author and writer, a neuroscientist, I think. To understand a little bit more about harm reduction and the war on drugs, I would recommend a book called Chasing the Scream by Johan Hari. And I think I'm also a big fan of just reading people's stories, narrative memoirs. Beautiful Boy is David Sheff's account of his son's addiction to methamphetamine, and it's really an incredible story. It's been adapted to a movie, but I'd encourage you to read the book. It's a better book.
I'll link to all those things you just mentioned in the show notes. So if folks want to get connected to any one of those or check out those books, you'll have quick links in the show notes to be able to find those pretty quickly as well. So you mentioned music. We have a Wildly Resilient playlist, which is on Spotify, Apple Music, and YouTube Music. So I have guests contribute to it. I have listeners contribute to it. So this is your chance to add to it. So what song, or maybe I'll give you a couple songs here, would you like to add that bring about the sort of sense of resilience in your life?
Yeah, so I'll kind of share this story with you. I told you, when you're addicted, music isn't much fun. It's hard to describe, but I would be driving up and down I-75 going to buy drugs, frankly, and the music would be down and the windows would be up, because there's just no joy in music when you're addicted. And then at the Salvation Army, one of the jobs I worked was by this old clock radio, and they played just nothing but country music out of this clock radio. And I just remember all of a sudden falling in love with music again. And there were some songs that were popular at the time. There's one in particular, don't make fun of me and don't ask me why, because I don't know why, but there's a song called Sweet Annie by Zach Brown Band that was just, it was played 5 times an hour at that time. And it gives me chills every time I hear the song. I don't exactly know why. Part of it is he's talking about having some struggle with an addiction to alcohol, but part of it is just I could feel again. I could feel music, and that just meant something to me.
Yeah. No, that's actually a really good song.
It is.
I like it. Yeah, I've seen them in concert before, and it was a great show. I think it's that attachment to where you were in that time and place too. And that is attached to that moment that you could feel again.
Yeah.
There's absolutely no shame in any one. You could have literally said any song. It could have been row, row, row your boat. And it would have I would have understood kind of why that was so important to you. So yeah, again, thanks for sharing that. Again, folks can find that in the show notes, or you can Google a Wildly Resilient playlist on Spotify, Apple Music, or YouTube Music. We're pushing a few hours on that playlist now. So it's an extremely eclectic group of music, but we haven't had a lot of country, so actually it works out really well. Cool. Yeah. All right, so the last word, what's the one message that you hope listeners leave with?
I think the thing I want people to understand about addiction the most is that addiction is suffering. And there's a perspective, sometimes a misconception that people who are addicted they're partying, they're getting high, and it's so untrue. It's such a mischaracterization of what's happening. Addiction is really suffering. There's a special sciencey word for it. It's called anhedonia. It means you're not able to experience pleasure. And that's what it is to be addicted. And I think that alone elicits some compassion from people when you just understand it's just people in pain trying to make their pain go away.
Well, thank you so much for coming on and sharing your story. I know you're used to doing it quite a bit, and you're really willing to do it, but like you said, the opportunity to do it one more time. I hope this reaches more than one person. I know the person sitting across the table from you, it reached me in the moment as well, even as I've watched this in family members as well. But I hope you as a listener take away really the power of, especially of that last message there that Alex was sharing with us. So Alex, again, thank you so much for coming on and sharing your story and sharing your incredible knowledge as well.
Thank you so much for the opportunity. Appreciate it.
Hey again. So throughout the editing process, I've probably listened to this episode 3 to 4 times through now. And each time it's been just as moving as it was when I was sitting across the table from Alex as we recorded in the Student Media Depot. If you take anything away from this episode, I hope it's that message of the need for humanity. That people affected by addiction are suffering in some way. And they deserve and require the support to, as one of my family members once put it to me, live the life they were meant to live. And whether it's in the process of recovery or any other pursuit we may have, any one of us can be trying and failing at the same time, because resilience isn't always linear and neat. That lens of humanity will move us forward individually and collectively. In addition to the resources Alex mentioned throughout our conversation, which you can find links to in the show notes, I want to highlight a couple more mental health resources available to UK employees. The first is the opportunity for 5 free appointments with a mental health therapist that UK employees receive each year. 2 of our in-house therapists specialize in substance use and addiction, as well as 2 of our community partners. These 5 appointments can be used by the UK employee, their spouse, or their sponsored dependent. I'll link to that information in the show notes as well. The second I would like to highlight is our new partnership with Headspace. We've collaborated with Student Success to offer the Headspace app free of charge to UK employees and students. With hundreds of exercises for meditation, sleep, focus, and movement, Headspace will help you start and end your day feeling like your best self. I've personally used Headspace for the past few years, and I'm very excited for us to be able to offer it to our employees and students for free. UK employees and students can check the show notes for information on requesting your free 1-year membership. In the show notes, I'll also include a link to the HR calendar where you can browse all upcoming work life and well-being events from University of Kentucky Human Resources. Until next time, take care of yourself and others, and stay well. Thanks for listening to Becoming Wildly Resilient. a podcast series from University of Kentucky Human Resources, Health and Wellness. The UK HR Health and Wellness team, consisting of certified health coaches, fitness experts, registered dietitians, and wellness specialists, offer a wide range of online and in-person programming to University of Kentucky employees, retirees, and their spouses. If you enjoyed this episode, you can listen and subscribe to future episodes wherever you find your podcasts. Connect with us on Facebook, Twitter, and Instagram by searching @UKY Wellness. There, you'll find links to episode show notes and more. You can also email healthandwellness@uky.edu with any questions or suggestions for future episode topics. To learn more about well-being benefits offered by University of Kentucky Human Resources, visit www.uky.edu/hr/wellbeing. Live well.